welcome to our channel. Today we are understanding a very crucial important topic about the immunology. The class should be in English mode and that should be very much understandable English mode so that everyone can understand it too much easily. There should not be any word that is complex. Every word are too much simple so that you can easily understand the whole things. See, that is the concept is complex in front of the immunology, but after completing this class you will not face any kinds of doubt regarding hypersensitivity. Okay, just subscribe our channel for regular getting classes, and I always saying you that just check our description box. There have the free group you may join, as well as you will get lots of update and M.L.T related update from the particular group. Okay, without wasting time, I am just starting the hypersensitivity. Firstly, we need to understand about the hyper. I always focus on concept. I always saying you these particular things that if you just want to attend daily classes, you have to just subscribe our channel. Okay, and you will get daily basis notified classes that completely free of cost. See, hyper defining that the highermost level, and sensitivity defining that your immune system will be more sensitive. Getting my point? So that our immune system, if its response is normal, it's fine. Okay, but if it's highermost sensitive, is it good or bad? Obviously bad, sir, because whenever any kinds of immune response or any kinds of thing are happening in highermost level, it's bad, right? Because whenever the highermost level they are doing, and they can destroy the tissue, they can damage the tissue, they can create the inflammation. So that if you are understanding here, see here, it is an X graded as well as appropriate immune response to an antigen. Whenever the antigen are coming, our immune response are happening X graded or inappropriate. Okay, both are abnormal in condition. Into the second thing, if you are understanding, that is the result that tissue damage or inflammation are happening. I always saying you that, as well as I already said you the particular things that the tissue damage are occurring as well as the inflammation are happening. Okay, because it's a disease condition, it's not a good condition, right? Because the immune system is highermost sensitive. See, there is a fourth type of sensitivity we need to understand. Okay, there have also 5 type of hypersensitivity, but type 5 is less important, so that I have erased into the particular short classes. Okay, and 5 type basically causes the Graves disease as well. That is the gel and comb classification. Hypersensitivity basically classified by the gel and comb. Okay, and now I am coming to say what are the 4 type. Please keep in mind that after completing this class, you can easily memorize what are the type, what are the phenomena occurring, what are the example of the hypersensitivity. For your exam purpose, you have to memorize the particular things. Okay, as well as for your concept purpose, it's also important. See, first one is the type 1, that is called anaphylactic. After that, type 2, that is called cytotoxic. After that, type 3, that is the immune complex mediated. After the type 4, that is the cell mediated or delayed type. Okay, anaphylactic or immediate, you will understand it whenever I am just explaining the particular things, then you will understand it. Okay, and each type required one particular slide, it will defining the each type. See, first one, if I am talking, I have to choose the another pen so that you can understand it properly. First one, see here, type 1 hypersensitivity. It is also called immediate. It is also called anaphylactic hypersensitivity. So that the question might become that immediate hypersensitivity defining, then you have to say that type 1. The question might be occur that anaphylactic hypersensitivity, then you have to select the type 1. Okay, see, that is an interesting term, that is the first and furious means that is the immediate. Okay, what is the particular things are happening? Allergic reaction due to the IgE antibody. Got it? IgE antibody basically attach into the mast cell and basophil. Whenever the particular antigen are come again, then they are basically doing the cross link. they are basically doing the crosslink. See, that is the mast cell or basophil. IgE, basically there is a IgE already attached to forming the crosslink. Okay, after that, whenever the particular antigen are again coming, they are attached into the particular crosslink, and they basically degranulation are happening, and whenever the cell degranulation are happening, then the histamine basically releases histamine. Okay, that is a chemical mediator. They basically releases and they causes the allergic sign. Got it? Okay, so that, see, so that which kinds of particular substance are creating the allergy reaction, that is called allergen. So that allergen might be pollen, allergen might be food, allergen might be drag, allergen might be dust. Okay, they all are the allergen. After that, sir, example, see here, hay fever. You need to understand the every example because it's too much important. Without understanding the example, the particular hypersensitivity completely waste. Okay, the examination basically asking you the examination, please keep in mind that, so that you need to memorize the example in the aspect of the hypersensitivity. First one is the hay fever, second one is the food allergy, third one is the bee sting, fourth one is the asthma. Please keep in mind that these kinds of whole disease are happening by the type 1 hypersensitivity. Sir, how much time takes to expressing this hypersensitivity? See here, they basically required second to minute for exposure. Okay, after exposure to particular antigen, they basically require second to minute. So that whenever the allergic reaction are happening into the practical aspect, you might see lots of time that within a minute the particular rashes are basically exposed into the skin. Yes or no? Right? See, after that, which kinds of reagent as well as marker is required? IgE antibody is required. Histamine, they basically releases chemical mediator as well as chemical particular substance. See, after that, mast cell is required because the mast cell basically, the IgE basically binds into the mast cell. Got it? After that, whenever the particular allergen are coming, then they are exposed the hypersensitivity. That's all are the type 1. Okay, after that I am coming to say that is the type 2 hypersensitivity. Please keep in mind that type 2 hypersensitivity, that is the cytotoxic. Please keep in mind that cytotoxic, that is antibody mediated hypersensitivity. Which kinds of antibody is required, sir? IgM is required. Okay, IgG is required. Okay, see, this IgM or IgG antibody are basically focused on the target antigen on the cell surface and the cell destruction are happening. That is, we can also say that autoimmunity. Okay, see, antibody and antigen are complex, basically form antigen antibody. After completing the complex, they basically activate the complement system, and the work of the particular complement system is cell lysis. I will take the class for complement system, don't worry. Okay, and whenever this IgG and IgM basically bind to the particular antigen antibody complex are occurring, complement system become activate and cell become lyse. Okay, and whenever the cell is lysing, is it good? No, sir, it's not good. So that hemolytic reaction might be occurred. Okay, autoimmune hemolytic anemia might be occurred. Erythroblastosis fetalis might be occurred. Please keep in mind that that's all are almost autoimmune, or that's all are occurred within our body. Please keep in mind that within our body by our own antibody. Please keep in mind that. So that, see here, antibody attacks to the cell, please keep in mind that antibody attacks to the cell, so that it's called cytotoxic type. Okay, as well as antibody mediated immunity. See, result the cell damage as well as tissue damage and cell death. And whenever the tissue become damaged, the cell automatically become death. Okay, the key component, that is the IgG, IgM and complement system. Okay, because without the complement system, the cell lysis will not occur. Complement system is required for lysing the cell. Without the complement system, the cell will not become lysed. Got it? That's all about the type 2. We have already understood that how the phenomena is occurred. Okay, now I am coming to the type 3 hypersensitivity. It's also an important hypersensitivity. We need to understand sir, how it's occurring? That's basically soluble immune complex mediated. Okay, antigen antibody complex mediated. Whenever antigen antibody complex going to wrong, then these kinds of hypersensitivity might be occurred. Okay, antigen and antibody complex are formed, and this antigen and antibody basically deposited into the tissue, then inflammation might be occurred. Please keep in mind that then inflammation might be occurred. Okay, and mechanisms here, firstly complex will be occurred, formation occurred, and whenever the antigen antibody complex are formation occurring, after that complement activation should be occurred, after the neutrophil attraction should be occurred, after that tissue become injured, and whenever the tissue injured are happening, it comes under the hypersensitivity. Got it? Because it's the disease, right? See, serum sickness, the example of the disease, please keep in mind that for the examination purpose it's too much important. Serum sickness, after that the Arthur's reaction might be occurred, after the systemic lupus erythematosus should be occurred. Okay, please keep in mind that whole kinds of example in the respect of whole type. Okay, after the result chronic inflammation might be occurred and tissue necrosis will occur. Got it? And what are the components there? Please keep in mind that which is the component. See, antigen antibody complex should be occurred, as well as should be involved, complement system should be involved, and neutrophil should be involved. Got it? Into the type 3. Hope the thing is clear. Now I am coming to the last, that is the type 4 hypersensitivity. See here, that is the cell mediated hypersensitivity. Which cells are T cell mediated. Please keep in mind that second, it is a delayed hypersensitivity. It takes 24 to 70 to 72 hours. See here, or 24 to 48 hours to appear. Please keep in mind that, so that it's called delayed hypersensitivity. Got it? It basically T cell mediated. Here does not require any kinds of antibody. Please keep in mind that. That is, first one is the see, T lymphocyte become activated. This T lymphocyte become releases the cytokine interleukin. They are activated to the macrophage activation. After that, tissue become damaged, and whenever the tissue damage are occurring, it's called the hypersensitive reaction. Got it? In every aspect, or in every types, you have already understood that how much that tissue become death, or cell become death, or tissue injury or cell injury are occurring. Whenever these kinds of injury are occurring or these kinds of damage are occurring, it comes under the hypersensitivity. Please keep in mind that. Okay, see here, that is first one is the contact dermatitis. Please keep in mind that, see, that is the contact dermatitis. After the tuberculin skin test or Mantoux test, we are doing for the latent TB identification. Whenever the tissue, whenever the TB is already happened, then we may identify at that the infection is already happened. Okay, after that tuberculosis granuloma, we can easily identify by the type 4 hypersensitivity. We all know that. See, the first line, that is a slow but powerful response. It takes time, but the response is too much powerful. Got it? Key components here, I have already told you that whatever the thing is required to activate the particular things, that is called the component. See, here is required the T cell, here is required the T cell, here is required the macrophage, here is required the cytokine. T cell activated, cytokine release. The cytokine basically activate the macrophage, then the tissue damage are occurring. Got it? That's all are the type 4 hypersensitivity. Now I am coming to the comparison. Please keep in mind that here is a 1, 2, 3, 4. Here is a 1, 2, 3, 4. 1, 2, 3, 4. Please keep in mind that, see, first one is the type 1, that is the IgE mediated, that is called anaphylactic. Second one is the type 2, that is the IgE and IgG and IgM mediated, that is cytotoxic. Please keep in mind that. Third one is the IgG, that is immune complex mediated, and fourth one is the T cell mediated, that is the delayed hypersensitivity. Please keep in mind that. And here is also the example of every kinds of hypersensitivity for you easy memorize, as well as for your easy recap. Okay, that's all are the regarding hypersensitivity in a very short small way, so that you can understand it. Okay, and just subscribe our channel for daily classes. Okay, and please keep in mind that just check our description box. Here is our batch available for the competitive. And if you are just beginner, if you are just completely beginner from West Bengal, we have also our milestone batch that we are covering the syllabus from completely beginning level. Okay, as well as we have our test series. Okay, we have our own ebook. Everything is available. Just check our description box and subscribe our channel for daily classes. Thank you so much for listening.